Today I would like to speak about how to diagnose by Magnify disease. First of all, I would like to introduce myself briefly. I live in Kochi Prefecture. Here is Tokyo. Here is Kochi, south of Japan. Yeah. There are a lot of sightseeing spots, such as Kochi Castle and Castle Beach. They are very beautiful place. And bonito is very famous, and I like bonito, and I often use sashimi, and often cook it by smoking by straw, and it smells nice. If you go to Prefecture, please eat this one. This is my hospital, Kochi Red Cross Hospital. This is in the center of my hometown, and this hospital is an emergency hospital. This is why I have to share a lot of patients. This is my profile. I was born in Okayama Prefecture. I'm 53 years old. And my specialty is the legs and magnify diagnosis of gastric cancer is my area best. But our hospital, the emergency hospital, I have to perform the other procedure. I perform everything without US. From 2005, I began performing for ESD, and from 2006, I performed Magnify endoscopy. And in 2007, I did observership at Fukuoka University. This is my boss. He's very famous for Magnify endoscopy and so on. And later, I continue self-training from now. Why Magnify endoscopy necessary? As you know, detection of early gastric cancer is essential for endoscopic treatment. Some early gastric cancer can't be diagnosed with conventional endoscopy, and delineating the extent of the flat regions is particularly difficult with conventional endoscopy only. This is why we have to run Magnify endoscope. Using Magnify endoscope, the microvascular and microsurface structure become visible. And this is because Magnify endoscopy enables the diagnosis of region that can be assessed by conventional endoscopy, and enable more accurate delineation of the region extent for direction than the conventional endoscopy. I show you the two cases. This region is on lesser curvature of the antrum. On white light image and NBI image, this region appear to be a little bit irregular, but I couldn't diagnose it's cancer or not. And I brought the scope to closer to this region and observed on low magnification. From this image, I could suspect this region might be cancer, but I was not confident. So I bring the scope more even closer, and that so the microvascular pattern is revealed, and we can see the microvascular pattern very clearly, and we can delineate the much of the region, and we can diagnose as it's cancer completely. The other case is in greater curvature of the lower gastric body, and there is a slight reddish region on white light image or chromendoscopy, but the extent of this region is not clear. And we observe on low magnification level the tumor margin still unclear. And so I observed at high magnification level, we can see the margin of this region very clearly, and there is a irregular microvascular pattern, and we can delineate the tumor margin like this. And requirements for running magnifying endoscope, we have to understand the normal gastric anatomy and gastric diagnostic method and endoscopic observation techniques. This schematic will show the mucosa of gastric fundic mucosa. We can see the small black spot. This is crypto opening, and the extremes surround this black spot called marginal crypto epithelium (MC), and microvascular running around them. This is typical fundic mucosa. Whereas this is a magnified endoscopic image, real image. We can see black dot, small dot, and the white line around this dot is MC. And microvascular running is around them. And the other typical mucosa is antral mucosa. In antral, the epithelial cells show villus growth and overlap each other, and this is because this is why we can't see a crypto opening, and microvascular running in the intervening part. This is typical image. This white line, painted line, is MC, and microvascular is running around the area surrounding MC. For diagnostic method of magnifying endoscope in stomach, methodology is magnifying method. Diagnostic method is based on the criteria of methodology. And first, according to methodology, we should assess the demarcation line. And if the demarcation line is positive, next we assess the microvascular pattern or microsurface pattern. This slide shows definition of the demarcation line. Demarcation line is defined as an abrupt change in microvascular or microsurface structures, and the distinct line can be traced around the entire circumference of the region. This is, for example, as shown in the picture on the left, there is a clear line. In such case, demarcation is positive. But in this picture, change is gradual, and this case, demarcation is negative. I'll explain using real image. In this picture, microvascular pattern and microsurface pattern. microvascular and surface pattern is changed abruptly. And we can delineate demarcation line like this. On right picture, the microvascular pattern, microsurface pattern here and here is different, but they change gradually. In such case, demarcation line is negative. And after evaluation, the demarcation line is positive or negative. We classify each microvascular pattern and surface pattern as regular, irregular, and absent. And if this region has irregular microvascular pattern or irregular microsurface pattern with the demarcation line, we can diagnose it as a cancer. Professor Yao, he's my teacher, recommends assessment of irregularity, 3 steps analysis. This slide shows 3 steps analysis. Step 1, we assess the irregularity of individual pattern. And next, we assess irregularities of overall arrangement as for morphology, distribution, and alignment. Step 3, we determine this region is regular or irregular. But it's difficult for beginner to understand, and so I recommend it's the best way to start with a simple approach. First, we identify the demarcation line, and second, compare microsurface and microvascular pattern with the surrounding gastric mucosa. If microvascular or microsurface pattern appear to be more irregular than surrounding mucosa, it suggests malignancy. And now I want to emphasize this key point. Diagnostic accuracy increase with higher magnification. I think it's an important key point. This is my data in my hospital. This table shows diagnostic performance according to magnification level. If I observe on low magnification, the quantitative diagnosis are about 82%, and extent diagnosis is 82%, a little bit low. But if we observe on maximum magnification, quantitative diagnosis is up to 98%, and extent one is 99%. It's very high. Why it is important to observe at the maximum magnification in these region. I'm sorry. Like this growing type adenocarcinoma and some post-helicobacter eradication gastric cancer and undifferentiated adenocarcinoma, the surface is covered by non-neoplastic epithelium. In these cases, it's difficult to make a diagnosis based on only the surface pattern. And this is because diagnosis should be based on the microvascular pattern. There are many studies have reported that even with magnified endoscope, gastric cancer is difficult to diagnose after HP eradication. These reports conclude that it's difficult to diagnose because these regions exhibit gastritis-like structure. This is why we need to observe microvascular pattern. to understand the microvascular architecture is really important. This scheme shows microvascular architecture. The smallest caliber microvascular, about 8 micrometer, enclose the crypt opening. And this form to and each capillary form to unite to form post capillary venue, and then drain to collecting venue. And most smallest caliber capillary we have to observe because maximum magnification is essential to observe capillary. I will show you clothing adenocarcinoma case. This is very challenging case. On white light image and chromoscopy, I couldn't identify the tumor bleed, and I observed on low magnification level. I couldn't still understand tumor margin. I show a video just before EST. This marking is created by lower magnification. This is a very difficult case. This tumor shows regular microsurface pattern. And I couldn't identify the tumor region on lower magnification level. And so I observed with magnification, maximum magnification. The arrow shows irregular microvascular pattern. I could identify the tumor region, tumor margin, and I put the margin beside of this tumor under magnification observing. This technique is a little bit difficult, but if you get this technique, we become able to diagnose this case. This is microvascular. This is irregular microvascular pattern. Here is microvascular, and here is the margin of this region, and I marked outside of the region. And I could mark for this region very precisely. Like this. And I will explain how to achieve high quality image. And we ask the patient to take PPI or vonoprazan before the date of procedure, before 1 week date of procedure. And I ask them to take Pronas and Zivescon and sodium bicarbonate with water just before our procedure. And the image enhancement status is also important. We recommend NVA enhancement is B8. And central glucose is interfere with magnifying the observation. This is because we have to rinse away this central glucose. And enhancement setting is also important. If we use enhancement level 8, For stomach, it's very strong. It's strong to diagnose, and it sometimes lead to overdiagnosis. And this is why I recommend enhancement level is B8. And to get a cluster image, I often use suction. And don't push the scope strongly. If you push the scope strongly, bleeding is occur from the cancer. And I always use black soft food. And before procedure, we put black soft food on the tip of the scope, and we adjust it using graph paper to achieve the proper focus on maximum magnification. Finally, I show you two cases. This case, this patient was scheduled surgical operation in the other hospital, and the patient, this case diagnosed as cancer because biopsy taken from this region showed group 4. And that patient visits my hospital by himself and requests re-examination. And I performed the Magnify endoscope. This region didn't show irregular microvascular pattern or irregular micro surface pattern, and there is no demarcation line. So I diagnosed it as non-cancer. And first I eradicated Helicobacter pylori, and 3 months later I observed it again. Yeah, and 3 months later the inflammation resolved after treatment, after Helicobacter pylori eradication, and now he still alive. And the other cases, it's referred for ESD, and before ESD I observed with Magnify endoscope. This region looks quite little white tissue, and the demarcation line wasn't clear on vitral image. And I observed on low magnification level. The oral side of this region, the margin is very clear on low magnification level, but other side was not clear. And later, I observed on maximum magnification level, the demarcation line was very clear, and I could remove by ESD very precisely. I show you video. The demarcation line of anal side is unclear on lower magnification. It's hard to put marking. And then I observed on maximum magnification. Microvascular pattern, we can see microvascular pattern very clearly on maximum magnification, and I could mark on outside of this region confidently. Like this. this is a take-home message. Magnify endoscope is essential for precise treatment of gastric cancer. Let's learn the basic structure of the stomach and the diagnosis method. And as the level of magnification increase, diagnosis performance increase. Thank you very much.